Our division has a really well-established transplant program. We're one of the largest transplant programs in the country, and we've had a fellowship program for many years. We carry out a lot of transplants in pediatric patients and care for a wide range of children with varying liver diseases. We have a really strong relationship with our liver pathologist, and we spend a lot of time reviewing liver biopsy slides and really learning about the histopathology of liver disease. Every time we do a liver biopsy, we go and review cases with him, and then we also have a monthly conference. I think that's really unique to our program, is the focus on that histology. Hi, I'm Chapin. I'm the program director for pediatric transplant hepatology here at Lurie Children's. As a freestanding children's hospital, Lurie Children's brings a lot of unique opportunities to trainees. You have the opportunity to work within a large, well-established division like our GI and transplant hepatology group, but then you also have the exposure to all of the other subspecialties and all of the experience and expertise that they bring, which I think is really valuable. I feel really fortunate to be able to care for children with liver disease. It's a really unique patient population. These children are often very sick, and the opportunity to be able to help them and improve their quality of life is really rewarding. Also, the opportunity to provide a life-saving intervention like transplant is really incredible. And to see a child go from basically being sick, so sick and in the hospital that they cannot do any of the normal things that a child can do, to then seeing them in the outpatient setting post-transplant, kind of a new kid able to do normal things is really incredible. We take care of really a large range of kids with different types of acute and chronic liver diseases, and we see everything from the most common to really rare disorders that you might only see a few in your career, and that experience is really valuable for the fellow. Being based in the city of Chicago, we also take care of a diverse population. We see children who are from kind of all racial and ethnic groups, and really a wide exposure in that sense. The fellowship is 1 year, and the fellow really splits their time between clinical and research work. So about half of the year is in clinical opportunities, and that's going to be being involved on rounds, being involved in the basic hepatology clinic, which is every week, as well as the transplant hepatology clinic, which is weekly, and then having the opportunity to attend a number of specialty clinics based on their interest. We have a fatty liver disease clinic, we have a Fontan congenital heart disease associated clinic, there's clinics related to viral hepatitis, and then there's lots of opportunities for education and for various conferences. We have monthly M&M, surgical transplant M&M conferences. We have weekly meetings with our multidisciplinary liver transplant group where we talk about all the patients and complicated cases. And then we also have journal clubs and peer reviews and a number of other things kind of scattered throughout the year. Within the organization and within the division, there's a commitment to diversity, equity, and inclusion, and being open to people from diverse backgrounds, diverse walks of life, and really trying to promote that within our trainees and within our fellowship, with the goal to best serve our diverse patient population and have that reflected in staff and trainees. The kind of person that is going to want to join this program and succeed in this program is going to be someone who feels passionate about pediatric liver disease and is interested in the pathophysiology and the care of those children, and someone who's interested in really the kind of constant quest for knowledge. We're definitely a group that is always looking to the literature and wanting to advance the understanding of pediatric liver disease, someone who's really inquisitive, and there's a lot of opportunity for didactics and teaching from all of our faculty, but also someone who's kind of self-motivated and driven, I think is going to do really well. Our fellows go on to do a diverse number of things. Some of them have stayed here at Lurie. Others have gone on to other large academic transplant centers where they have continued to work in the field of transplant hepatology. I would say that most of our fellows do end up continuing on a career path where transplant hepatology is their primary focus, although some of them continue to do general GI, and that's been kind of across the country at a wide variety of institutions. Thank you for your interest in our program, and we hope to hear from you.